Hi, my name is Kurt Ribisel. I'm the chair of the Department of Health Behavior, which is one of the participating departments in the health equity concentration. It's my pleasure to tell you a little bit about the work I do and the teaching. The class that I teach is called Health Behavior 730, Theories and Frameworks for Health Behavior. So we work on topics that like alcohol use, tobacco use, diet, obesity, physical activity, vaccination, and we look at different theories that help people understand why people practice certain health behaviors and how to actually change and ameliorate them. We also have a focus on policy and media advocacy because I'm a big believer that policy is one of the great ways to change health behavior in a very efficient way at scale or to reach large populations. I also, when we look at my research, I do work in the area of tobacco control policy. So I've done some work on cigarette warning labels, e-cigarette warning labels, and vaping products. I've done some work on preventing e-cigarette sales to kids, how we do age verification. I'm also interested in the sales and marketing of the products. So two things I'd mentioned. One is on menthol. So menthol products like Newport are used by about 8 out of 10 African-American adults in the US, but only about 3 out of 10 white smokers. But these products are very hard to quit, and they cause a high burden of lung cancer in the US. So over 100 communities have now banned the sale of menthol products. And I've been interested in what would happen if we were to ban the sale of menthol. What would the impact be? I'm working with Dr. Sarah Mills, who's leading a project on estimating the impact on lung cancer in the African American community if these products were banned. And I think it's a key social justice issue because the products are often cheaper in African American neighborhoods and they're widely available. And the tobacco company really targets smokers in these areas. And lastly, one of the other areas I work on in tobacco control is studying the distribution or the sales, the distribution of the density of cigarette outlets or places such as gas stations, convenience stores, supermarkets, pharmacies, and wholesale clubs. And we find that there are about 31 tobacco retail outlets in the US for every one McDonald's. And this pattern holds true in almost every state, that there's a far, far greater concentration of tobacco retailers than McDonald's or any other fast food restaurant for that matter. And we're looking at how do we reduce the density and number of tobacco outlets, and also the fact that they're concentrated more often in areas with a higher percentage of African Americans, Latinx individuals, or lower income individuals. And so given that there's a social justice of having more tobacco outlets, which are related to youth and adult smoking, I've been thinking about regulatory approaches. And one of the ones I've studied is banning tobacco sales in your schools. And in fact, we find if you ban all tobacco retailers from operating within 1,000 feet of a school, you eliminate all of the disparities by race, ethnicity, and income level in tobacco outlets. So I'm very interested in sort of pro-equity policy approaches like banning menthol, restricting the sales and marketing of cigarettes, and the distribution of the outlets. So finally, I would say one last project I work on is one called the Durham Back on the Bowl initiative. And Durham is sometimes called the Bowl City. It's only about 8 miles away. And I'm working with a team to promote COVID safety at small businesses that employ essential workers. We have a team of community health workers that have visited over 1,000 businesses in Durham. We partner with a group called El Centro Hispano and NC Central, which is an HBCU in Durham. And we have visited and identified over 250 Black and Latinx owned businesses. Our health workers, our ambassadors have been visiting these businesses, and we've already signed up hundreds to get vaccinations. We have special equity allocations where we're getting the workers vaccinated and addressing any of the questions they have. And it's a great project to promote vaccine equity and also get the businesses back on their feet and to get people visiting them and promote vaccination. So thank you. It's a pleasure telling you about my work, and I hope you come to UNC.